Welcome, everybody. Welcome to our telephone town hall meeting. Thank you so much for joining us tonight. We are going to be on for the next hour. We've got lots of guests, lots of questions to answer. Now, if you have a question, please press 0 on the keypad on your phone. 0 if you have a question. We have some people standing by to collect your email address. If you want our newsletter, that would be great. Press 7 for that. 7 on the keypad on your phone. They'll stand by and they'll get your email address so we can send you updates from time to time. So again, a couple more times, welcome everybody. Welcome to our telephone town hall meeting. Thank you so much for joining us tonight. If you have a question, please press 0 on the keypad on your phone. We can either bring you live for that question or we can read that question over the air, whatever you're most comfortable with. We have a lot of guests on this call. We've done this before, and we have a lot of questions that are asked. So don't hesitate. Press that 0 and let's get your question in. Also, press 7 if you want to provide us with your email address, so we can get you on the email list and provide you with updates, as it were. Mayor, take it away if you would, please.
Well, good evening and welcome to this Tele-Town Hall meeting. And I'm Mayor Jeff Williams. And usually we conduct Tele-Town Hall meetings in individual council member districts and then open the topics up to anything on the minds of our residents. But because we know so many of you are concerned about the coronavirus pandemic, we have gone citywide with this Tele-Town Hall. And we're dedicating the next hour to answering your questions about the coronavirus. And I've assembled the top experts in our city to answer your questions. And joining us are our fire chief, who oversees our emergency operations center, Mr. Don Krausen, our city manager, Trey Yelverton, police chief, Will Johnson, Michael Jacobson, the president and CEO of the Greater Arlington Chamber of Commerce, and Dr. Cynthia Simmons, the city's medical director, who has an extensive background in emergency medicine. Well, we're all here to answer your questions about the virus, such as, how is Arlington combating the spread of it? Is the stay home, work safe disaster declaration and social distancing working? And how is Arlington working with our small businesses to help them during these tough times? And when is the governor going to end the disaster declaration and open up? And other resources out there to help people who are struggling during this time. And speaking to that last point, I want everyone to know how important it is for us to reach out and check on our friends, family, and neighbors. You know, social isolation is a critical component of the effort to stop the spread of coronavirus. But it can leave behind some of our most vulnerable, and we just can't let that happen. In fact, we want to help that tonight. If you are a senior, a disabled resident, or someone else who is unable to leave your home and do not have someone regularly checking in on you, please press 1 if you would like someone to call and check in on you. So press 1 if you would like someone to call and check in on you. This proved to be very beneficial after our last Tele-Town Hall on March the 31st, when a group of United Way volunteers reached out to 128 people who responded. Those contacted, including a 62-year-old female with a broken wheelchair who needed new tires for the chair and essentials such as toilet paper, paper towels, and bleach. And she was referred to the Aging and Disability Resource Center. A mother with 2 adult sons and 1 a veteran who had lost their jobs due to COVID-19 was referred to TX Service North Texas and 211 for employment, child care, and financial assistance. Another example was a woman who has not been able to visit her mother in a nursing home and asked about sending her a care package was addressed to the Aging and Disability Resource Center to learn about such programs here in our community. So it's very helpful. So remember to press 1 if you need assistance. And then before we begin, I also want to say thank you for social distancing and washing your hands. It's working. It's making a difference. And we know it has not been easy to go through the stay home, and we're very appreciative because you are helping to save lives. Now let's start getting to your questions. Process is easy. You can choose to just listen in on the conversation, or you can also pose a question. But thank you for participating, and let's take our first question.
We can do that right away. Let's take Roger. And Roger, this is for you, Trey. Roger, welcome to our telephone town hall meeting. Roger, go ahead, please.
Yes, and when this all started, I would go out to the parks and take walks and take a cup of coffee, and I'd go sit down in one of the pavilions and at the picnic table and drink the coffee. And I mean, the park's empty. I mean, I'm doing the social distancing. And the signs outside the park say, please do social. They say the park's closed, but then they talk about if you're walking to keep apart and this and that and the other. Why in the world did they come around and put tape around it? So now you can't sit at a picnic table in the pavilion, but there's picnic tables in the middle you can sit at, and excuse me, there's nobody around. There's no reason why I should be able to go sit at a table I help pay for and have.
Well, let's get that answered if we could. Roger, go ahead, please.
Mr. Guest, Trey Yelverton, City Manager, thank you for that question, and certainly appreciate the frustration that you have. I know many of our residents who enjoy our parks love to go out and do many of the things that you're talking about. At the beginning of this onset, we were really concerned about minimizing the social distancing, and in many of our parks, our pavilions are very popular places. And not all the time during the week are they full, but certainly on the weekends we have large gatherings and some parties that would show up in various parks from time to time. So a decision was made to prevent those from occurring. And unfortunately, it sounds like in your area it's maybe not as used heavily, and you have lost your place to enjoy coffee. And we hope that real soon that'll be able to be available to you again in the future. And we just would beg your patience as we all try to stop the spread by responding to social distancing and minimizing the impact of COVID in our community.
Thank you, sir. Chief, you're up next with Linda. Linda, welcome to our telephone town hall meeting. Linda, go ahead, please.
Yes, my question is the availability of testing in Arlington, not Dallas County, not Fort Worth, in Arlington.
Thanks for the question, Linda. This is Don Krause, the Fire Chief. I want to let you know that we've been working on this issue for a number of weeks. The mayor, county judge, all the folks in leadership of Tarrant County have been working on the testing issue, and I'm happy to say that hopefully by next week we'll have a testing location here in Arlington. We'll be announcing it officially. I think the county judge, in fact, has been quoted today in the newspaper, testing occurring in Arlington. We'll be disclosing that location sometime next week, and we'll begin testing those who are symptomatic over the age of 65, who are healthcare workers or first responders. As we have more details, we'll certainly be publishing that information on the city website and sharing it through the media. But thank you for the question, and we're excited for the testing.
Our next question is from Veronica. Veronica, welcome. Dr. Simmons has this question. Veronica, go ahead if you would, please.
Thank you so much for having us today for our questions. My question will be if they were talking about the Aging and Disabilities Department. My mom lives in a retirement center, and I wanted to know if they've been regulated by them to make sure that they get the right food, the right stuff, and they don't get to starve in the rooms. And how they make.
Hi, Veronica. This is Dr. Cynthia Simmons, and thank you for that question. So there's two different classifications of retirement centers. Some are registered, and if they're registered, they're registered with the Texas Department of Health and Human Services, and that is the regulatory agency for retirement centers. There are also independent retirement centers within the city of Arlington. We have, as a city, and through the Arlington Fire Department, had a team that has been going out to all of the retirement and independent living centers within Arlington to assess the situation, the need of the staff, and the needs of the residents. So if you're aware of a need that's not being met, we would see if we might be able to assist you with addressing that. And you're welcome to call us at 817-459-5500, and we'll see what we can do to address a specific need. Thank you.
Thank you so much for that. I want to remind people, if they want to provide us with their email address so we can get the electronic newsletter to you, please press 7 on the keypad in your phone, 7 on the keypad in your phone. We have operators standing by for that. Sophia's next, and this is for the chief. Sophia, go ahead with your question, if you would, please.
Yes, hi, good evening. First of all, I would like to say the city of Arlington is doing a great job. My question is, we're going to continue the way it is. I see on the news where a lot of governors and mayors are trying to open up the cities. Are we going to stay where we are as far as lockdown, or are the cities going to open back up?
Sophie, thank you for the question. This is Don Crownson, the fire chief, and I think the answer to this is that's an evolving situation. The president has just announced some general guidelines for the governors to comply with regarding potential of opening counties and cities back from the current social distancing standards. I think we're waiting for tomorrow. The governor of Texas will do a press conference, and from that point, I believe our county judge and our mayor will make some decisions based on what they hear from the governor. As of right now, we are still in the same mode we've been in through April 30th. Some of these situations are still yet to be defined for us. Once they are, some decisions will be made, and we'll be communicating with the public directly on those issues. Thank you for the question.
Sabrina's next, and Sabrina's question's for Jennifer. Sabrina, welcome to our telephone town hall. Sabrina, go ahead with your question, if you would, please.
Hello, everyone. How are you all today? My question is that I am self-employed, and I've been trying to get in touch with the unemployment office. I've seen on the news to where they're saying that they're adding more and more people on to help. I've already applied. Somewhere along the line, I've had an error on my application process. And to email them, text them, call them with no avail, no luck. It's getting a bit frustrating, though it's nothing I can do about it. Can you all give me any suggestions on how to get around that, because I have no money coming in?
Hi, Sabrina. This is Jennifer Wickman, Assistant City Manager here in Arlington. You are experiencing something that many other people are experiencing with the Texas Workforce Commission. They do have a large volume of calls coming in. They have open 7 days a week from 7 to 7. And additionally, if you look on their website, they are suggesting people with certain area codes call on certain days. I'll let you know that people with area codes beginning with an 8 can call Tuesday, Thursday, Saturday in the morning. And if you're a 682 number perhaps, those hours are Monday, Wednesday, and Friday in the afternoon. So that would be 1 to 7. I'll also suggest for you or anyone who may be having concerns about paying your rent, our housing authority is collecting information about that for possible assistance. Their website is www.arlingtonhousing.us, and clicking on the Arlington Cares button, there's a form that you can fill out about ability to pay rent and utilities.
Shannon's next. Shannon for the chief. Shannon, go ahead with your question, if you would, please.
Dean, you're on.
Shannon, are you there now? I'll do with Shannon's question. Well, Shannon wants to know when they're going to be opening salons and nail places.
Shannon, this is Don Crownson, fire chief, and I want you to open up as soon as you can. I think the mayor and council, all of us want to get the city back to work, but I think the reality is we're still paying attention to the virus and what it's doing. We're listening to the medical community, and we're trying to figure out what are the next best steps to get Arlington back into position to be working and have our businesses open. That will come, as we said earlier, the president has issued some guidelines for the governors. The governor of Texas will be doing a press conference tomorrow. And from there, I believe the county judge and our mayor and council will be reacting to that information and determining what our next best steps are. There are a number of issues that we do have to clear in order to get Arlington back to work, and I think those are mostly dependent on the virus and the medical issues that we're dealing with now. So as soon as we know, we'll be communicating that message to the public directly through the media and through the city council. Thank you for the question.
Thank you, sir. Ollie's next for Dr. Simmons. Ollie, welcome to the call. Ollie, go ahead with your question, please. Ollie, you're up. Go ahead, please.
Hello?
Hi, Ollie. How are you?
Oh, I'm okay. Thank you.
What's your question, please, Ollie?
Well, I'm 91. I'll be 91 this month. And I live alone, but I have a son that doesn't have a place right now to live. And he stays with me, but he goes out visiting young ladies, and I don't like the area that he goes in. And I was wondering, what could I say to him? I've already told him I didn't want him to live with me if I didn't know where his whereabouts are.
Hi, ma'am. This is Dr. Simmons. I'm sorry to hear about that issue with your son. I guess I'm glad that you're staying home. That's really important, especially because we don't want you to be exposed to the virus. And I think that might be an important conversation for you to have with him. I guess if he's going out to get food and bring that back, that would be important. But if he's, going out for other reasons, that might be a conversation to have with him and ask him to please limit that so that he is not exposed and inadvertently bring that virus home to you. And I wish you the best and wish you good health, and thank you for calling us this evening.
Oh, and thank you. Let's take Joe. Joe has a question. I think this is for the doctor also. I'm not sure. Joe, welcome to the call. Joe, go ahead with your question, please.
Yeah, we've all heard of hydroxychloroquine and various ways it's being used across the country and in various states. I guess my question is, specifically in Arlington, if someone comes down with the virus, how would something like that be handled? Is it being used, number one, and is it up to the patient if they want to try it, or only up to a doctor? Or I guess my question is, do we have access to that?
Hi, Joe. This is Dr. Simmons. And the answer to your question is yes, there are definitely studies that are ongoing worldwide with regards to hydroxychloroquine and its efficacy in reducing the viral load of COVID-19. To answer your question specifically, it is available in the United States. It is definitely available in Arlington. You require a doctor's prescription to get that, and if you were concerned about taking that or wanting to take that, you would have to see a physician to be able to get the hydroxychloroquine. So very good question, and thank you for asking that.
And this next question is from Joanne. It's for both the mayor and the chief. Joanne, go ahead with your question, if you would, please.
Yes, I'm concerned about Arlington reopening when they don't know how many potential COVID carriers there are. I'm looking for testing for everybody in Arlington. I am over 65 with conditions, and I want to know if I'm going to be among carriers of this disease, and how are we all going to be tested?
Well, I think this is definitely one right for the chief here, without a doubt, because testing has been very important, and needless to say, there is a shortage throughout the United States, but it has been an all-out effort there working with our county to be able to bring in testing, and we have had to prioritize that. So, Chief, share with us about that.
Sure, Mayor. So far, testing has been rather limited. The availability of the test has been rather limited. It is growing. In fact, next week we'll be starting our own testing facility for those who are symptomatic, over the age of 65, healthcare workers and first responders. As far as testing the entire population of Arlington, I think that's a difficult proposition. The tests are primarily designed for those who are symptomatic or in a risk group. Those are the ones that are receiving our primary focus. We are also watching the number of patients that are in the hospitals, and we're happy to report that those numbers are very stable, in fact, are declining. I know there is some national discussion about antibody testing to see if there is some community immunity to the disease. I think that is still a considerable time off, but I know there is a commitment to community testing, and we are working as hard as we can to make sure that that type of testing is provided to our citizens based on their symptoms and conditions. Thank you for the call.
Taria, welcome to our call. This call is both for Dr. Simmons and the Chief. Taria, go ahead with your question if you would, please.
Okay. When I go out, I notice that there's not a decrease in traffic nor a decrease in population in the stores. So I was wondering, in the Arlington area alone, what is the confirmed amount of people that actually have COVID in Arlington?
Hi, Tahira. This is Dr. Cynthia Simmons. As of today, we have 193 cases of COVID in the city of Arlington.
Gotcha.
Thank you.
Okay. Let's. Yemi's next. Jennifer, since you're here. Yemi, go ahead with your question for Jennifer. You're up. Go ahead.
Hi, hello?
Hi, go ahead with your question, please.
Okay, hi. I just have okay, I don't know if this is something you guys can help me with, but so I am also on a visa.
Hold on 1 second. Yemi, you're going to have to speak a lot louder, so start over again real loud if you would, please. Better.
I was saying that I also to work in because of the COVID-19, and like you guys direct us to go to the unemployment and apply, but since like I've not been able to work since like March 8th, and I've been trying to apply online and also call, they brought out the new schedule for the calling for people with the area code 8. And every time I call within those time, almost like all day, like I'm not able to reach anyone. I've sent emails. I have tried to apply online. It does not work even after like 3 o'clock in the morning. Like it doesn't work. It just directs me to call the people, but I'm not able to get in contact with them. And I have no income coming. And I try to apply for SNAP, but as well, I'm not qualified for that because I'm a student who does not work. So it's like, I have no other options to do. So I just.
Yemi, let's try and get your question answered if we could. Go ahead.
Hi, Yemi. This is Jennifer Wickman with the City of Arlington, Assistant City Manager. I appreciate your frustration with the unemployment system. There have been a large number of people trying to connect with that, and so a lot of people are in your same spot. I will say we have heard that if for the online applications, if you look between 10 p.m. and 8 a.m., it is lighter traffic then, which is good. We have also had a suggestion from one of our state representatives that if you have concerns about this system, please contact your state senator or your state representative. If you don't know who that is, if you go to state.tx.us, there's a who represents me that you can find, and then you can find the contact information for those locations. So good luck, and the mayor would also like to share something.
Well, State Representative Tony Tenderhold has contacted us and said you can call his office at 817-478-5009 if you're having trouble getting through, and his office will assist. Thank you, Representative Tenderhold.
Can I add one?
Oh, yes, Michael Jacobson.
So it's Michael Jacobson with the Chamber. I would add this, that we are going to have a representative from the Texas Workforce Commission on our Facebook Live event that we do at 1 o'clock. So next Tuesday at 1 o'clock, if you go on Facebook and go to the Greater Arlington Chamber of Commerce, we will have somebody from the Workforce Commission there. And you'll have the ability to ask questions. Now, it depends on how many questions we get and the time that we have. But that's another, if you go to the Greater Arlington Chamber of Commerce Facebook site on Tuesday at 1 o'clock, we will have a representative from the Texas Workforce Commission.
Thank you for that. Shalonda's next. Shalonda, this question's for the chief. Shalonda, go ahead with your question if you would, please.
Yes, I have health conditions, and I go to the gas station, to the stores, and to the fast food stores, and the workers are not wearing gloves or masks, and I'm just concerned if that could be transmitted to me because I have to drive back home and wash my hands.
Shalonda, this is Don Krause, the fire chief, and the answer to your question is the employees are not required to wear masks. I would encourage you to exercise proper social distancing to protect yourself, maybe even investing in a mask yourself to help protect yourself. I know that the employees at stores and other locations are being told to properly conduct themselves in a manner that's considerate of the customers. But I would first put yourself first in protecting yourself, and I would take the steps that you can take to make sure you're safe. If you see a situation that you think puts you at risk, you should step back from it and consider another option. But thank you for the question, and be safe.
Let's take another question. It's from Bill. And Bill, this is for the doctor. Bill, go ahead with your question, if you would, please.
Yeah, hi. I'm an 83-year-old man, and I have received both of my pneumonia shots. And I'm just wondering if someone with pneumonia shots, as I have, my chances, God forbid that I would contract this, are my chances better surviving this because I have had pneumonia shots? I haven't heard this addressed at all on TV because what I understand it's...
Well, hold on. Let's get this answered. Go ahead, please, doctor.
Good evening, Bill. This is Dr. Cynthia Simmons. And I will tell you that, unfortunately, the pneumonia shots do not help with prevention of COVID-19. COVID-19 causes a viral pneumonia. And unfortunately, the pneumonia shots are great for getting bacterial pneumonias, but they don't prevent in COVID-19 or help lessen the severity of the disease. So the best thing for you is at this point to stay safe through social distancing and stay home to stay healthy.
Our next question is from Kira. Kira for the chief. Kira, welcome to the call. Kira, go ahead with your question, if you would, please.
Hi, good evening. So it's I guess it's a question, but so you have the personal protective gear, you have people asking about testing and all of that great stuff, but yet my question is, why in the world would anybody lift the gate for this situation when there's not even a cure for it? As I sit back and I look at this and I watch my family and the concerns of everything, this is just like a fire getting ready to have some flame added to it in my perspective, because once it happens again, it takes one more person to create that again, and what if it just starts all over? So in my...
Thoughts, please.
Kira, this is Don Krausen. We've been dealing with viruses for a number of times over the last decade. Certainly the coronavirus is a very serious one. It's a new one, and we're learning from it. We have developed systems that quickly respond to outbreaks in the community. We've been able to isolate those outbreaks when they do occur. Sooner or later, the virus will subside, and folks will be able to come back out and go back to work and enjoy their lives. However, the virus will likely never go away. So it is likely to become an annual sort of issue that our community will have to deal with. The medical community and your first responder community is working on systems to identify outbreaks when they occur and to put those fires out when we see those. But we'll never, ever be able to completely eradicate this virus, I don't believe, not in the next year or two. And we're all waiting on the vaccine. However, by exercising good social distancing and other precautions, we should be able to limit the contagion factor. And the city is now adjusting to that and building our systems to mitigate those issues as they do materialize. Thank you for the question.
For the doctor, from Beatrice, we have a question from Beatrice. Go ahead, if you would, please.
Hi. I'm a senior, and my home is Chicago. I've been here for a while, but now I need to leave and go home. My problem is because of cancer, I only have one lung. I have diabetes and high blood pressure, but they both under control. I take care to use masks, gloves, and wash my hands. I'd like to know how safe it is for me to travel from Fort Worth to Chicago. Right.
Thoughts, please.
That is a really tough question and decision that you have there facing you. it is important, of course, for you to be back home, and the incidence of COVID in the Chicago area is much higher than the incidence in the Fort Worth and Arlington area. And so you taking all of the precautions that you mentioned, including using gloves and using a face mask and social distancing, is important and very important in your case with health conditions that you mentioned. But I will tell you the incidence is higher there. We would love for you to stay in the Arlington area and enjoy our beautiful weather. And I sure do wish you good health and hope that you stay safe. Tough decision. Thank you.
Rodney's next. Rodney for the chief. Rodney, go ahead with your question, if you would, please. Rodney, are you there? I did not see Rodney there. I'm gonna read Rodney's question. Why are we just starting testing? Why not 3 weeks ago? How many positive tests? That's from Rodney.
Rodney, it's Don Krause, Fire Chief, and thank you for the question. We've been testing for quite a while, for over a month, mainly the symptomatic cases and those of the high-risk groups. In fact, of the nursing homes in Arlington, we've done over 400 tests of folks who are considered high risk or symptomatic cases. We're doing these as they materialize. Currently in Arlington, the positive case count is 193 positive cases. But widespread testing or test sites are still about a week away, and you'll see more testing as more testing becomes available. One consideration that has been a problematic issue is lab capacity, and fortunately, we're now starting to see lab capacity and testing machines availability growing. So you can look forward to more testing occurring here in the near future. Thank you for the question.
Let's bring Tracy next if we can. Tracy for Jennifer. Tracy, go ahead with your question, please.
Hi, I'm also self-employed, and several people have already addressed the fact that we can't get through to talk to anybody. And I had originally going to ask about that, but my question now is, are they going to adhere to the deadlines that you only have so many days or so many weeks to appeal or to request your payments, because you can't get through to do any of that? So are they going to adhere to those? Or is that going to be retroactive back to when you initially applied?
Thanks, Tracy. This is Jennifer Wickman. The Texas Workforce Commission's website states that there will be no one who will be penalized for issues that they can't get through due to the call volume. So I would take that to mean that, no, they are not going to penalize people who can't get through. They're well aware of the situation, and you can, as we've stated before, if you do run into issues with that, you can certainly contact your state representative or state senator, but I do not guess that they're going to be penalizing anyone for being late simply because they can't handle the call volume.
Laquita, welcome to our call. Laquita for the doctor, go ahead with your question, please.
Okay, so I've seen on the news Dallas is requiring everybody next week to wear face masks out in public. Is Arlington considering doing the same thing and like potentially opening the nail shops or the hair salons with face masks? And then the second thing that I wanted to address was I have lupus, and so I went to get tested because I have mild to moderate symptoms, and I ended up having to pay like $200 at the urgent care to go. But I'm seeing on the news that the tests are supposed to be free.
Hi, Laquita. This is Dr. Simmons. So I'll try and answer that question for you. The first part of your question was with regards to face masks, and I am aware the city of Dallas has implemented a mandatory face mask policy that I believe starts on Saturday. We in Arlington would recommend face masks if you're going out, and it will help you in terms of spreading the disease, in terms of asymptomatic transmission, and it may also offer you some protection by wearing a simple face mask or a homemade face mask. But we are not at the point where we're going to make it mandatory within the city of Arlington. The nail salons, I think Chief Krausen answered that question a little bit earlier. He mentioned that the federal government has issued some guidelines just today And certainly we want all of the salons to open as soon as they can, and we will be evaluating that with respect to our caseload here in Arlington.
Yes, and to follow up on that, I think, Don Krausen, the Fire Chief, I think in a transitional strategy, nail salon, we would be asking for you to consider wearing a mask as you're serving your customers. I think that would be a potential transitional step. It has not been defined yet, but would logically be most of those nail salons are fairly close proximity to the customers, and anything we can do to protect the employee and the customer from potential spread, we think those things would be good ideas to do. Thank you.
Thank you, team. Let's take another question. It's Norma. Norma for the mayor. Norma, welcome to the call. Norma, go ahead with your question, please.
First of all, I wish to say hello to everyone. Can you hear me?
Yes, we can.
Okay. Hello to everyone. God bless everyone, and God bless the city of Arlington and all the surrounding cities. My question is, I understand that Governor Abbott will be announcing some kind of guidelines to open some businesses. As far as General Motors goes, how are we going to be protected for our own safety returning back to work with approximately 4,500 people?
Norma, this is Mayor Williams. As a matter of fact, General Motors actually operated for a couple of weeks here under very strict guidelines that they imposed that were, one, they screened the employees, took the temperature, made sure that they had not come into contact, and if anyone didn't pass the temperature test or the questionnaire, then they were sent home. In addition to that, their areas were clean, but then again, the employee was given disinfectants and so forth to also clean the area before they ever began work. And then in addition to that, they were given a mask to wear. And then they also practiced social distancing. There were other things done throughout, but very rigorous program, and it was very successful. We'll be continuing to work on that as we move forward here in the next restrictions. And as Chief Krausen just said, we got new guidelines there from the President today, and I feel certain that we'll be getting some more from the Governor here very shortly. But General Motors has been very conscientious there in following the restrictions and guidelines.
For Alita, for Jennifer. For Alita, go ahead with your question, if you would, please. For Alita, go ahead with your question, if you would, please. You're on. I'll read her question. For Alita's question, frontline workers, essential workers, will this group be getting the $25,000? That's for Alita's question, and this is for Jennifer.
So in answer to that question, the frontline workers or all workers, any workers making less than $75,000 individually will get $1,200 and should be starting to get that soon from the federal government. Couples with an income of less than $150,000 will get $2,400, and then any children claimed on the most recent tax return will be $500 each for those individuals. Additionally, and this may not relate to Ferlita's question specifically, but any individuals who are currently on unemployment will get an additional $600 per week between the beginning of April and the end of July. So I hope that information helps with her question.
Thank you so much for that. Jennifer's next. This is for the Chief. Jennifer, welcome to the call. Jennifer, please go ahead.
Hey there, I have a question. I was asking about face mask. I was watching the news today with Judge Jenkins, which I don't mean any disrespect to him or what he said, but he was showing ways to potentially cover your face, and he was showing things like bath towels, pillowcases, scarves, things like that. And I know that wearing masks improperly when taking them off, putting them on, handling your face, inside, outside, all of that, really poses more harm than good. And I was wondering if you could address that. And then I was wondering if there was any way we could possibly have a link on the Arlington website of all of these amazing seamstresses that are selling masks with the filters and everything.
Thank you, Jennifer. It's Don Krausen, Fire Chief. And I think, to the judge's point, I think any sort of covering that prevents contagious elements coming from one person to another person is a good idea. However, you're correct. It has to be done correctly. And I think the fact that you know that and want to pay careful attention to how they use a mask or a scarf is a key factor in one's personal safety. I think we certainly can link on the city website or the COVID website for the city potential information regarding how to make your own mask and things like that. I think that could be helpful. We'll take a look at that. But certainly the mask issue is about one's own personal safety and protecting yourself and in some respect, protecting others if you're ill. So the masks are not a bad idea. I think they just have to be done right as you highlighted, and we appreciate the comment.
As a matter of fact, Chief, the Surgeon General is actually featured on our website showing how to make the mask. I was impressed. He did that himself and showed how to make the mask properly, and he used a cut-up T-shirt there and some elastic bands there to do it.
I want to remind people if they want to provide us with their email address so we can provide you with email updates, please press 7 on the keypad on your phone. Pete is next, and Pete, this is for Trey. Pete, welcome to our call. Pete, go ahead with your question, please.
Yes, I thank you for this opportunity to call in. And unfortunately, it's, I guess you would say a criticism, if you will, but Tarrant County and specifically Arlington, which is the city that I live in, obviously, is sorely lacking on information on a day-to-day basis as far as where we stand. There was an article in the paper, the Star Telegram, about the lack of information. Dallas County has Clay Jenkins coming on there letting us know what the status is, and nobody is doing that in Arlington, and we're kind of in the dark in that respect. And I applaud, I got to end this with a compliment, I applaud your efforts in what you're accomplishing here, but in my opinion, this is if you're going to rely on the internet and you're going to rely on a format such as this, it's lacking considerable.
Thoughts on that, please, Trey?
Thanks, Pete. This is Trey Yelverton, City Manager. Appreciate the feedback, and would just encourage you to pay attention in particular to our social media and internet. That is a significant way for us to communicate to our residents. We're putting out probably half a dozen stories, if not more, every day that are posted to our website, arlingtontx.gov, and on the front page there's a coronavirus bullet with tons and tons of information behind that. We're doing video posts. The mayor's done several Facebook Live messages. This is the second telephone conference that we've done. We'll continue to do these periodically. There'll be a direct mail piece hitting everyone's mailboxes this week. And then the information that's being broadcast by the news stations are really relevant for most of the Metroplex. So when you hear Mayor Price or Judge Jenkins or Mayor Williams, all that stuff is still very helpful to all of our populations. But if you're looking for Arlington-specific data, our website has the number of cases, our hospital bed rates, the number of fatalities, various guidance pieces. It's very, very robust. And I would encourage you just to take a good, deep look at that and let us know what other suggestions you may have for information you need.
Pete, this is Mayor Williams. One of the disadvantages Arlington has is we don't have any TV stations here, and the decline of the newspapers, we don't get a lot of coverage here. So consequently, we have a very robust website there and a communications department pushing things out. So please go there and you will find factual information. And then I think Mr. Yelverton was right on there because of our close proximity. The information that's on the TV is applicable to us, even though we don't get covered. But it's a great opportunity for our citizens to let the TV stations know that they need to cover more about Arlington. We're a large city too and deserve that coverage. But also, I want to share with you, the Greater Arlington Chamber of Commerce has been putting on a whole lot. Mr. Jacobson, share with them what you've been doing.
Oh, every day, Monday through Friday, we have something online, and we're bringing all kinds of information that I think are important for businesses to know, but it extends beyond our business community as well. So there's a significant amount of information that is going out there for our citizens and our business, and information that people need to know and see. I'm going to say something that the city and the political folks won't say in the room because they're going to be kind. I'm going to tell you that always running to the media isn't the best form of governance, and why some people may see that and they look at that and say that this person is doing a great job. That's not necessarily the best way. And so I think Arlington has done a really pretty good job, and I realize that there's a lot of people that need information, and in this world we live in today where everybody goes to their different channel to find that information, it does make it challenging. But the city's website is great. The chamber has good information. There's good information out there, and if there's anything that we're not providing, as Trey said, please let us know, and we'll help get that information out there.
Let's take our next question for Deborah. Deborah, this is for the chief. Deborah, go ahead with your question, if you would, please.
Yes, and thank y'all for taking our questions, and I'm learning so much. I had several, but I've heard most of them answered through this. And just to let you know, I'm a senior, 68, been in Arlington since junior high, graduated Arlington High in 70. So I'm an Arlington fan and always have been. But I guess I'm down to the question of, are seniors on Social Security that aren't filing income tax really going to get some kind of payment?
Thoughts on Deborah's question, please? Anybody?
Ms. Wood, this is Jennifer Wickman. Yes, ma'am, you should be getting that, and there's additionally a website. If you have not filed your taxes in the past few years, there's a website that the IRS has where you can fill out information to make sure they have your contact information and perhaps your banking information. But you will get that same relief check that others will get. It may be a little delayed if they don't have your information, but if you have been filing your income taxes, you should not worry. It should come right to you just like everyone else.
Thank you for that. Let's take another question. It's Richard, and Richard, this is for Michael. Richard, welcome to the call. Go ahead with your question, please.
Yeah, this is primarily for Michael Jacobson, with whom I worked in D.C., but it's also for possibly the mayor or somebody else who might have an interest in it. I'm a 77-year-old asthmatic, and so I have to stay home quite a bit of the time. My doctors have even said, don't come in unless you have bad symptoms. So I order out a lot, and I try to order things online since I can't shop. But I don't know whether there's a list, a directory of merchants locally who do business online that I can use instead of paying Amazon for everything. And secondly, when I order from local restaurants, a lot of times the delivery apps I have aren't the ones they use. So is there, or could Michael's organization make up a list of local merchants that we can patronize online, and which delivery apps each restaurant uses, so we don't waste so much time trying to figure out where we can get our food?
Hey, Rick, I'm happy it's Michael. It's great to hear your voice. And by the way, he's one of the best speechwriters around. I can't believe you're that old. That's not possible. So let me answer your question. For restaurants, we've done a really good job of having a list. Our CVB in town, and you'll find it at the city website and on the chamber website, we have a list of over 160 restaurants that are operating with drive-through and pickup. And you can see that list on our chamber website and the cities and the CVBs. So for restaurants, that's a good list that's out there. We just had the conversation this week about how do we gather all the other online opportunities and merchants that are out there. For the restaurants, it was pretty easy to do when you're talking about all of the retail that exists. It's a little bit more of a challenge, but it's a great question, and we're thinking through that, and if there's a way of pulling some information like that together. So we're looking at that. We don't want everybody to have to go to Amazon. That should not be the answer. We want to make sure people have that opportunity to buy local. And so it's a great question, and we are looking at it.
Thank you. Joe for the chief. Joe, go ahead with your question if you would, please.
My name is Joe Patterson, and I wanted to find out if Arlington is going to make a demand or a requirement for everybody to wear a mask.
Hi, Joe. It's Don Krause, the fire chief. No, ma'am, we're not going to do that. We're going to ask that our citizens respect our social distancing guidelines. We would expect that our merchants would also pay attention to that in order to keep their customers safe. But we feel that the distancing issue is a highly effective way of doing business. You can personally take the extra step of investing in a mask and protecting yourself.